Good morning, this is Carla Lomilio, and my presentation is about two experts I found on the field of domestic violence, and we'll be discussing those experts, the reason for research on this very important topic, and information where the viewer can find important links to the information you'll be hearing about. Domestic violence. Why does she stay, and why do partners batter? I felt these questions were important when I began the research project in week 1. We were told to choose one topic, and I did, of course, end up choosing the victims of domestic violence and to answer the question why she chooses to stay. I also found it was important to understand the impact on the victims of domestic violence and abuse and on her emotional health and her ability to recover, who the victims are and who the batterers are, what sort of psychological makeup they are, and I felt that it was an important topic because I realized the magnitude of the problem. And according to the American Psychology Association, 1 out of every 3 women has experienced intimate partner abuse during her lifetime. So the questions again, why does she stay and why does he batter, are the topics I will be focusing on in my research. Now we'll introduce our experts. Dr. Hillary Abrams, who is a professor at the University of Bristol. She conducts research and she's worked extensively on the support needs for the service and service provision for families where domestic violence is an issue. And Dr. Javier Fernandez Montalvo, he's published more than 100 articles and book chapters, as well as 5 books about the behaviors that accompany batterers and people who commit violence in the home or in domestic situations. Dr. Abrams is actively involved in facilitating debate about research ethics and research methods for vulnerable populations and the value it has in counseling and psychotherapy. Dr. Abrams is also the author of Supporting Women After Domestic Violence, a wonderful book that really outlines the entire process that a battering victim undergoes as she decides to leave. Dr. Montalvo has been studying domestic violence batterers for years. He's definitely helped further the research in this area and feels that psychological treatment is currently seen as the most appropriate option for batterers, and he feels that the most important thing that needs to be addressed during that treatment is because the aggressors continue to deny or at least minimize their battering behavior. So recommended treatments according to Dr. Abrams is first an assessment of PTSD diagnosis, which is an acronym for post-traumatic stress disorder. Next, she feels it's important to address the need to feel safe for the victims, and once they do feel safe, to teach them coping skills. Dr. Montalvo believes that the focus for treatment for batterers is to accept responsibility, teach them coping skills to prevent relapse, and coping skills so that they don't return to their battering behavior. However, both agree that batterers can be either gender. These are the references that I found helpful in my research. Thank you and have a good day.